Hi there, everyone. My name is Dr. Michael Wald, and welcome to Ask The Blood Detective. As I've just mentioned, my name is Dr. Michael Wald, and I'm your host and resident blood detective. That's a nickname that I was given years ago for being able to find a rare condition in an individual after years of failed efforts elsewhere. So today's topic is constipation conundrum, and what you should know about constipation is that it is the most common medical condition visited by gastroenterologists. And based on my 30 years experience with people with constipation who have visited many different doctors, including, of course, gastroenterologists, the medical treatments are a mixed bag at the very least, and often don't even focus on the actual reasons for the constipation. So today, we'll be diving deep into the topic of medical and natural treatments for constipation. Constipation, you should know, is a very common digestive issue that's been, or can, I should say, be a cause of discomfort and major life disruption. We'll explore various approaches to constipation, including vitamins and mineral therapies, herbal approaches, exercise, stress management, and a few others. So let's get started with the questions that you guys have given me that I'll be answering during this podcast. To begin with, let me just give you my contact information and a bit of a disclaimer. I'll start with the disclaimer. This information obviously is for your education. It's not meant to substitute for sound medical or health advice. And any use or misuse of this information is on you, the listener, or the reader. And I should mention that detailed notes of all of my podcasts beginning in 2023 can be found on my website if you search the search bar on the homepage at drmichaelwald.com. So that's drmichaelwald.com. And to send me your comments and questions and show ideas, you can do that by emailing me at info@blooddetective.com. And my phone number is 914-552-1442. And I practice in Westchester County, which is an hour north of New York City. So what are the more common questions that people want to know? First of all, and I'm going to read them to you because I've collected them from you. What are some common causes of constipation? So as you might know, I'm going to give you a little brief answer now, but we're going to get into more details in a few minutes. Constipation is caused by a variety of factors such as a low-fiber diet, inadequate fluid intake or dehydration, lack of physical activity, that's a big one. There's a lot of medications that can cause as a side effect constipation. There are hormonal influences and even just regular psychological stress. So identifying the underlying cause or causes is crucial in determining the most effective treatments available, whether they're medical, nutritional, or a combination. The second most common question I get is, how can vitamins and minerals help alleviate constipation? Briefly, certain vitamins and minerals just play a role in maintaining a healthy digestive tract and preventing constipation. For example, vitamin C helps to soften stools, while magnesium promotes bowel movements by relaxing the muscles in the intestines. So, that right there is important, where we have a difference in how vitamin C and magnesium works. So I'll repeat that. We know that magnesium helps to relax the muscles in the intestine, which often can help constipation. And vitamin C helps to soften the stools. So when people ask me, Dr. Wald, what's the best treatment for constipation? I can't know that unless I know the cause or causes. And then I might use a softener, or if I want to relax the muscles of the intestines, I might use magnesium. Sometimes it will be a combination of these particular treatments, and I might even add other ones. Also, you should know that adequate intake of B vitamins is also very important for proper digestion, and also B vitamins are needed to produce energy in the body, and moving the intestinal tract, moving the bowels along is an energy-consuming event. Another common question I get are, what are some specific herbs that might help relieve my constipation? So first of all, herbs can help promote bowel regularity. We know that senna leaf, for example, cascara, sangrata, aloe vera, ginger root, and even licorice have been shown to help. These herbs all have a laxative effect to help stimulate bowel movements when used appropriately. If you overuse them, you can have a reverse effect, which is the exact opposite of what you want, which is constipation. Another question is, how can exercise help? with constipation? That's a really good question. Exercise has numerous benefits for not just overall health, but also to aid in relieving constipation because physical activity helps stimulate the muscles in the intestines, promoting regular bowel movements. And exercise also reduces stress levels, and stress can absolutely lend itself to digestive issues. I'll be doing an entire podcast on the role of anxiety and stress, not just for constipation, but for a lot of health problems that are completely overlooked by mainstream doctors. You know, I had a young patient in here in my office a few days ago who has a lifetime problem with constipation, and she's only 20 years old. She's been suffering this for years. She's on or has been on every medication that is available in medicine and in gastroenterology, and they barely work. Within just a few minutes of me meeting her, it was obvious that she had a level of anxiety that was pathologic, that I felt was of the level that could, of course, affect the autonomic nervous system, which is the nervous system that autonomically or automatically manages bowel movements. It's the same nervous system that manages stress and anxiety. So if someone has issues with stress and anxiety, they can manifest physiologically or physically as constipation. So I just wanted to mention that here briefly and encourage you to listen to the anxiety show. That should be on the website. You should be able to search for that by the published date of this show. And if you don't easily find it under the podcast section, just search the search bar on the homepage and it will come up. Another question is, are there any lifestyle changes that can prevent or alleviate constipation? So certain lifestyle changes can be beneficial in preventing and alleviating constipation. So I might speak with my clients about their fiber intake, for example, and staying hydrated and incorporating the right types of regular exercise into their lives that might stimulate intestinal movement and reduce stress, and also managing one's stress levels overall. And very importantly, which many people with constipation do not seem to know about, is you want to establish a consistent bowel routine, getting your autonomic nervous system to respond by causing a bowel movement simply because you went to the bathroom at a certain time. It could take weeks. It could take many, many months for the autonomic nervous system to be taught this habit, but it's worth trying. All right, let's back up for a moment and let's define constipation a little bit better because there's different types. So as I've mentioned, constipation is a common gastrointestinal disorder that affects millions of people worldwide. It occurs when an individual experiences difficulty in passing stool, they have infrequent bowel movements as a result, or they may have a feeling of incomplete evacuation. And the primary function, you should know, of the gastrointestinal tract is to break down and process food, absorb nutrients, and eliminate waste products. And constipation arises when the process of waste elimination is disrupted, and that'll lead to a buildup of fecal matter in the colon, lots of inflammation, leaky gut in the intestine. And for those of you who do not know what leaky gut is, that means there is the inflammation occurring in the large intestine. It can also occur in the small intestine. And that inflammation will irritate the intestinal wall, causing what's called the tight junctions, the space between the cells, to get wider. And that can allow for undigested food products and even microorganisms and other toxins in the stool from leaking from the intestinal lumen in the large intestine into the blood. And that could cause a cascade of inflammatory events and immune events and toxicity. It is a mess. So, as I mentioned, constipation arises when waste is not eliminated right. And there's two basic forms of constipation. There's functional constipation and there's organic constipation. So functional constipation refers to cases where there's no identifiable cause of the constipation, while organic constipation is caused by an underlying medical condition, such as a neurological disorder, hormonal imbalances, or even structural abnormalities of the GI tract. Some people are born without the proper musculature in the small intestine, and that can lead to constipation. Others are either born with or acquire hormonal imbalances, and the intestinal tract does get neurohormonal signaling, and if that signaling is off, constipation can result. And there are neurological disorders where there's not the proper nerve innervation or supply of nerve impulses to the intestinal tract, and the result is, again, constipation. So there are many other factors that can contribute to the development of constipation or worsen either the functional type or the organic type. And just to remind you, and I encourage you to read the notes of this podcast, which you can download simply by first searching for the title of this show on the homepage, Constipation Conundrum. So what are some other factors that in general can worsen constipation? And this is somewhat of a repeat, but I'll be adding more information onto this as we move on. Number one, there are dietary factors. So commonly a diet low in fiber in a person who's underhydrated and someone who, let's say, has an excessive consumption of certain medications such as opioids, all of that can lead to constipation. Lifestyle factors such as too much of a lazy or sedentary lifestyle, lack of physical activity, can contribute to irregular bowel movements and thus constipation. And there's a bunch of different medical conditions such as irritable bowel syndrome, hypothyroidism, and Parkinson's disease, all can cause constipation. And the young woman I mentioned to you that I met earlier who had, about 15 years of chronic anxiety with constipation, she also happens to have hypothyroidism. Hypothyroidism, okay, that's low thyroid, commonly causes constipation, and she had no idea. And her doctors never mentioned it to her, ever. So not only did the gastroenterologist not mention anything about the hypothyroid, because a gastroenterologist will tell you, I'm sorry, that's not my field, go talk to an endocrinologist or perhaps your internist. And then neither of those doctors, even though they knew and diagnosed her with hypothyroidism and had to have known about her constipation if they reviewed her health history, still did not connect for her in her mind the potential relationship between low thyroid and constipation. So obviously I'm going to address that. And then there are neurological conditions. I mentioned one earlier where there's damage to nerves that control bowel function. That can lead to constipation. So constipation can be managed through various treatments and lifestyle modifications. And here's a few of them. Number one are dietary changes. You want to incorporate more fiber-rich fruits into your diet, such as whole grains, various fruits and vegetables. All of these natural foods and various types of fibers can help regulate bowel movements. Increase fluid intake. Drinking adequate amounts of water can help soften the stool and facilitate its passage through the colon. And then there's regular exercise. If you engage in regular physical exercise, that'll help to stimulate the muscles of the gastrointestinal tract and promote regular bowel movements. And then there's all sorts of medications. In some cases, over-the-counter laxatives or prescription medications may be needed to alleviate constipation. However, sometimes these medications have just the opposite effect on people. So let me review some of the medical treatments for constipation. And unlike a lot of holistic shows, nutrition shows, natural shows that shy away from medical treatments, I think that just rips you off. I think that people need to know what the medical approaches are for things. And for the very least, if we know what the medical treatments are that might work, a properly trained holistic healthcare provider might be able to come up with natural means that work the same or very similarly to some of the successful medical treatments. And at the very least, too, you might try all the natural treatments. They may not work. And you need to now know what those medical treatments are. So let's go through some of them. So again, we know that constipation is a common disorder. What it is infrequent bowel movements. They're just not passing as much. And one of the things used in medicine are laxatives. So laxatives are medications or substances that help promote bowel movements and relieve constipation. They work by softening the stool, increasing the bulk, and they also help stimulate the muscles in the intestines to move waste through the digestive system. And there are several types of laxatives available either over the counter or by a prescription. So So there's four basic groups. There's the bulk-forming laxatives. Bulk-forming laxatives. So these laxatives contain fiber that absorb water and add bulk to the stool, making the stool easier to pass. And then there's stool softeners. Stool softeners help moisten and soften the stool, making it easier to pass without straining. And then there's the osmotic types of laxatives. So osmotic laxatives increase the amount of water in the intestines and help soften the stool and stimulate bowel movements. And then finally, there are the stimulant laxatives. So we reviewed the bulk-forming laxatives, the stool-softening laxatives, the osmotic laxatives, and the stimulant laxatives. And the stimulant laxatives irritate the lining of the intestine, causing contractions that help move stool through the intestinal system. So it is very important, if not essential, that the long-term use of laxatives should be done under the auspices of medical supervision, because the problem with these laxatives is that they can cause dependency and worsen constipation and cause a type of disruption in the bowel that could lead to death and certainly a surgical emergency when they are overused. And then there is the prescription medicines. So in cases where over-the-counter laxatives are not effective or appropriate, a healthcare provider might prescribe medications specifically designed to treat constipation. And those are the following. Lubiprostone is a common one. This medication increases fluid secretion in the intestines and helps improve bowel passage. And then there's linaclotide. Linaclotide works by increasing fluid secretion and reducing the pain signals in the intestine, promoting regular bowel movements. And then there's prucalopride. Prucalopride stimulates the muscles of the intestines, helping to move stool through the digestive tract. So these prescription medications are typically reserved for individuals with chronic constipation or those who have had a poor response or no response to other treatment options. And then there are enemas and suppositories. So in certain cases, when constipation is very severe and does not respond to other treatments, enemas or suppositories might be used. So these methods involve the introduction of a liquid or stool substance into the rectum to stimulate bowel movements. Enemas work by softening the stool and lubricating the rectum, while suppositories help stimulate the muscles in the rectum to push out stool. And then there's biofeedback therapy. A lot of people don't think about this, but biofeedback therapy is a non-invasive treatment option that can be helpful for individuals with chronic constipation caused by dysfunction in the pelvic floor muscles. So during biofeedback therapy, sensors are used to measure muscle activity in the pelvic floor while patients practice techniques to improve muscle coordination and relaxation. This therapy can retrain the muscles involved in bowel movements and improve overall bowel function. And then there is surgery in rare cases when constipation is caused by an underlying structural issue or blockage in the intestinal tract, sometimes scarring, tumors, for example, even large polyps. Surgical intervention may be the way to go. So the surgery aims to remove or bypass whatever the obstruction is, allowing for improved bowel movements. So once again, it's important to consult with your trained healthcare provider before starting any medical treatments on constipation. What I'm going to do for the rest of this conversation on constipation is I'm going to review several very important herbal approaches to constipation, as well as some prebiotic and probiotic approaches, and the use of vitamin C and magnesium for relieving constipation. So I'm going to start with psyllium husk. So psyllium husk is a natural fiber supplement that's derived from the Plantago ovata plant seeds. It's widely used as a bulk-forming laxative because it absorbs water and forms a gel-like substance in the intestines, which helps soften and bulk up the stool, making it much easier to pass. Psyllium husk is available in various forms. You can get them in capsules, powders, granules, and they can easily be added to smoothies, juices, and even sprinkled on foods. There's been lots of studies that have shown that psyllium husk is effective in treating constipation. including, during my research, a 2015 meta-analysis that was published in the British Journal of Nutrition. And a meta-analysis, just so you know, is a combination of, well, it's a type of study where all of the useful, properly performed studies on, in this case, psyllium, are performed, and all of the poorly designed studies or loaded with bias or for some reason or another are useless are eliminated. And that's what a meta-analysis is. And when not everything has a meta-analysis evidence, but psyllium husk does. So it's definitely worth trying. And then there's aloe vera. Aloe vera has been used for centuries for its medicinal properties, including its laxative effects. So the gel obtained from the aloe vera plant contains several compounds such as acemanin, which stimulate bowel movement and helps soften the stool. However, it's very important to note that aloe vera may only be used in its gel form, as the latex from the outer leaf can cause severe cramps and diarrhea. So just to clarify that point, the aloe vera that you consume should be entirely inner leaf, because when you remove the leaf, you have the gel underneath. That's my point. And aloe vera, just like psyllium, had a meta-analysis done in 2014 published in the World Journal of Gastroenterology. And then there's senna. So senna is a plant native to Egypt, and it's been used for centuries as a natural remedy for constipation. It contains active compounds. I won't go into their long names right now, but they stimulate the large intestine and help to speed up bowel movements. And senna is available in various forms, such as teas and capsules and tablets. And it's typically used for short-term relief of constipation. However, it should not be used for more than 1 week without consulting a healthcare professional. And some really fantastic research has been shown that senna is effective in treating constipation in many people. And that was demonstrated in a 2012 study published in the Journal of Herbal Medicine. So basically, herbal approaches like those I've just mentioned for constipation offer many people a natural and often much gentler alternative to conventional medications. And some of the most effective herbal remedies, including psyllium husk, aloe vera, and senna, are at the top of the list. It is important, again, to talk to your healthcare provider about this, because depending on what medications you're on, consuming some of these products might block the effect of some of these medications, may affect their absorption and the utilization of the body in a variety of ways. Now let's talk about magnesium, because almost everyone seems to know about magnesium with constipation. So magnesium is a mineral that plays a vital role in muscle relaxation, including the muscles of the digestive tract. And there are two layers in the intestinal lining, as they say. It helps draw water into the intestine, softening the stool and promoting regular bowel movements. So that's what magnesium basically does. It helps to draw water in the intestines. So you'd want to be conscientious of consuming magnesium-rich foods. So increasing these foods in the diet might help your constipation. So good sources of magnesium include leafy green vegetables like spinach and kale, which also have a great fiber content, legumes, nuts such as almonds and cashews, seeds such as pumpkin and sunflower seeds, also whole grains and avocados. And again, just to remind you, all of these notes you will find on my website at drmichaelwald.com if you search the search bar on the home page. And then there's magnesium supplements. So in some cases, magnesium supplements may be recommended to alleviate constipation. Magnesium citrate or magnesium oxide are commonly used forms. It's very important that you, again, be careful adding doses of magnesium, because magnesium can interfere with the use of other nutrients. It can cause side effects like hypotension, lowering blood pressure excessively. It can cause a person to be fatigued, and it can slow down a variety of other functions like thinking. So once again, when you consider which combination or which one of these natural techniques to use, you need to do that with a healthcare provider that can help you determine the best one based upon your genetics, the fact that you have constipation, how long you've had the constipation, what are the causes of constipation, what are other comorbid health problems that you have, which might, for example, make it such that magnesium or some of these other fibers might be contraindicated for you or really not in your best interest. There is something called a magnesium loading test, which some practitioners will use to establish someone's magnesium need and also to help constipation. It's sometimes called the magnesium tolerance test or magnesium challenge test, and it's a diagnostic test used to assess magnesium deficiency in the body. So it involves administering a high dose of magnesium and monitoring the body's response to determine if there is an adequate level of magnesium present. So, for example, during the test, a person's given a high dose of magnesium orally, or sometimes it's done intravenously under medical supervision, obviously. The dosage can vary depending on the individual's age, their weight, their overall health, all those other factors that I mentioned before, medications, genetics, other comorbid health problems. After administration of the magnesium, the patient's urine is collected over a specified period, typically 24 hours. The urine is then analyzed to measure the amount of magnesium excreted in the body. So magnesium loading testing can be used to help constipation. And then there are the old favorites, probiotics. So probiotics are beneficial bacteria that promote a healthy gut microbiome, as it's called. So these probiotics can help regulate bowel movements by enhancing digestion and promoting regularity. So there are probiotic foods. So consuming foods rich in probiotics can be an effective approach to constipation. Examples might be organic yogurts and live cultures, kefir, sauerkraut, kimchi, and other fermented foods. Fermented foods are amazing for the bowel. And then there's probiotic supplements. So probiotic supplements are also available in powder form or capsule form, in other forms too, and they can give you and are made to give you a concentrated dose of beneficial bacteria. And it contains different strains of probiotic organisms, and they have varying effects on the gastrointestinal tract. There are even probiotics that are particularly good for anxiety. So if I have a person who has anxiety and constipation, I'm going to give them a different probiotic supplement than I'm going to give someone without anxiety, let's say. And if a person has eczema and constipation, I'm going to give them yet a different combination of probiotics, because some probiotics are great for eczema and for constipation together. Okay. So don't worry too much about this, because if you're working with a trained healthcare provider who has knowledge in probiotics, they will be able to figure out the best probiotic for you. And sometimes, though, it does take some trial and error. Certain medications are contraindications for the use of probiotics. I'll just give you two common ones. If you're on blood thinning medications, taking probiotics may interfere with the effectiveness of these blood thinning medications, because the probiotics can produce vitamin K in the intestinal tract, which is a pro-clotting agent. And if you're on an anti-clotting medication, that could be a disaster. The other thing is, if you're taking antibiotics, you do not want to be taking probiotics along with your antibiotics. You want probiotics of a certain type, but you want to take them at least an hour away from any antibiotics. Otherwise, the antibiotic will completely kill off most probiotics. There are some exceptions to this, but it gets technical, and it's not really something I think the average person and the populace should be trying to figure out. You want to speak with a qualified healthcare provider about what medications are contraindications for natural treatments for constipation. Now I want to talk about something really important, and this is the last thing I'm going to cover now, and it's called the vitamin C flush procedure. Some of you might have heard of this test. It's been around for a while, and it needs, again, to be used under supervision. There are several several reasons why you should not do a vitamin C flush. Sometimes people with hypertension, it will increase their blood pressure. In other individuals that have a genetic glitch called a G6PD deficiency, that's called G6PD. If you have this and you take vitamin C, it could cause a serious health crisis, manifesting as what is known as hemolytic anemia or a hemolytic crisis, where the vitamin C can cause the red blood cells to explode, and that is not a good situation. There are other reasons not to take vitamin C. They're again too numerous to mention, but given during a thorough medical review and health history intake plus questionnaires, practitioners can narrow down very accurately whether or not vitamin C in the form of the flush test or just taking vitamin C is the right thing for you to do. And of course, there are different forms of vitamin C, and I'll get into that. So first, I'll let you know that you probably would want to increase vitamin C-rich foods in the diet because vitamin C does help to stimulate the muscle contraction of the intestinal tract. Vitamin C helps to promote favorable probiotic growth in the intestinal tract. It's an antioxidant. Vitamin C is an anti-inflammatory. So again, it's very helpful for constipation and other gut problems. So foods that are rich in vitamin C that could also help constipation are citrus fruits like oranges and grapefruits, strawberries, kiwis, bell peppers, broccoli, tomatoes, all are excellent sources of vitamin C. And then, of course, there's vitamin C supplements. Sometimes you'll want to use ascorbic acid, which is vitamin C, the most popular form. And other times you do not want to be consuming the acidified form of vitamin C. You want an alkalizing form of vitamin C. Some of you are going to jump to the conclusion that you're overly acid, and of course you would want alkaline vitamin C, but that doesn't make any sense. You want alkaline vitamin C because that's what you want to use during a flush procedure. If you use ascorbic acid during a flush procedure, you might give yourself an ulcer, gastritis, esophagitis, or even ulcers. So the vitamin C flush is performed by using a form of vitamin C known as ascorbate. Ascorbate is an alkalized form of vitamin C that contains certain minerals which have created this alkaline property of vitamin C. So we're going to use the ascorbate flush or form for the flush test, or what we call the vitamin C bowel tolerance test. And again, this method of vitamin C for constipation is used to also determine how much vitamin C a person needs, what's called their tolerance. So it involves the person consuming increasing amounts of vitamin C every 30 minutes until they have diarrhea. And then the amount of vitamin C they need is obviously, for ongoing need, is not the amount that causes diarrhea all the time, but an amount that's just under that keeps the bowel moving regularly without causing outright diarrhea. But the first time a person does this test, we hope that it will cause diarrhea. So you might want to write this down. First, you want to start with vitamin C, which is in a powder form, which is known as ascorbate vitamin C, or vitamin C powder or vitamin C crystals. You want to be home with access to a toilet and plan on being home for about 5 hours performing this test. All right, so you start with a level teaspoon, which is about 4 to 5 grams of vitamin C powder or crystals. You're going to mix that vitamin C with water. To make it a little easier to consume, you might maybe cut the water 50% apple juice, but I don't want you to use a full glass of saturated apple juice because, again, you're going to be doing this procedure. You might have vitamin C intake several times, and you don't want to consume all that fruit juice. So mostly I just say that people should consume the level teaspoon of vitamin C powder in a half a glass of water. You want to consume that every 30 minutes until diarrhea occurs. Once the diarrhea occurs, you discontinue the test. You calculate 2/3 of the total amount of vitamin C it took to produce the diarrhea. That's what you're going to need every day in 2 divided doses. That should keep you regular. The procedure itself, the vitamin C flush test, should result in diarrhea. Think of it this way. So the rationale behind this procedure is that when the body has reached its maximum capacity to absorb and utilize vitamin C, the excess amounts are excreted through the bowels, resulting in loose stools or diarrhea. So by determining the point at which this occurs, this point, the individual can estimate their optimal dose of vitamin C. So it's important to note that performing a vitamin C flush test, it should definitely be done under official and medical guidance because it can result in side effects that need to be managed. You should expect diarrhea, if we're lucky, cramping, gas, and sometimes nausea. Those things usually go away within a few hours of the test, sometimes the next morning. And other times, you might do this vitamin C flush test, and after 5 hours, by 5 hours, you haven't had a flush. That means you're in pretty bad shape. I usually have people stop the flush anyway at that point because it might kick in a delayed way. You might have a loose stool at 6 hours, or it might occur the next morning. And it may not occur at all, which means you need more vitamin C. But I found that there are a lot more complications and side effects if I continue past 5 hours. So I usually have a person start this flush again on another day if they didn't have a flush within the 5 hours the first time. Now, just so you know, even the most difficult intestinal tracts tend to respond favorably with diarrhea within 3 hours. It's very possible a person can take a single dose of vitamin C and have diarrhea. Some others, it takes 2 doses. Some, it takes 3 doses. And the more you do this over time, it takes less and less and less vitamin C. And you can actually titrate the amount of vitamin C that you have learned works for you to have you have that regular bowel movement every day without diarrhea. And as I've mentioned, just keep in mind that the flush procedure almost always will cause temporary gastrointestinal discomfort, loose stools, diarrhea, cramping, gas, okay? If you have even nausea, if you have any other symptoms beyond those, and certainly if you have those, you want to let your healthcare provider know. So that's going to do it today for my review of constipation. For those of you listening, thank you so much for suggesting the topic because, again, it's a condition that I see all the time, and it makes sense that many of you have a concern. You've been listening to the podcast on Ask The Blood Detective, known as Constipation Conundrum. You'll find all the notes on the website at drmichaelwald.com. Email me your questions and comments at info@blooddetective.com. If you want to reach me by phone, you can call me at 914-552-1442. Thanks, everyone, and have a great day.